testing. I'm Julissa Hernandez, one of your hosts for today.
And I'm Beatrice Rivera, and today we will be presenting the story of a young lady whose name is Lucy No.
Lucy is a really excellent student. She loves to play golf and is the captain of the cheerleading team.
She excels in mathematics and literature, and now we should go to her video. Let's check it out.
Okay.
My name is Lucy No, and I'm currently 16 years old. I'm captain of the cheerleading squad at Westminster High School. I'm part of the golf team, and I'm an honors student. 8 months ago, I was in a life-changing situation. Me and my boyfriend of 2 years decided to make a mistake actually. And I found out I was pregnant by using a pregnancy test. Dr. Ibrahim, I bought this thing at the store and it came out being positive. Is that accurate?
Lucy, you just took an at-home pregnancy test. This pregnancy test will indicate whether or not you are pregnant, and most of the time they are accurate.
So now we're going to take a blast to the past and take a look at the origins of pregnancy tests. Let's go look at Dr. Ibrahim's explanation.
One of the earliest urine-based pregnancy tests can be found in ancient Egyptian times, when women who might be pregnant would urinate on wheat or barley seeds. If the wheat or barley grew, that meant that the woman was pregnant. But if nothing grew, that meant she would not bear at all. However, for many decades, the best method of diagnosing pregnant women was to remain careful of their observations of their own physical signs and symptoms. American public health advocates also started to encourage women to see their doctors as soon as possible when they suspected that they were pregnant. During the 1920s, scientists recognized that there was a specific hormone that was only found in pregnant women, which we now know today as human chorionic gonadotropin, or HCG. Tests on rats and mice were also used to develop more advanced theories on pregnancy tests. Fast forward to the 1970s, and pregnancy tests were now available to the American public. This allowed women to protect their privacy while giving them a new opportunity to take an active role in their own health care.
Guys, so me and Beatrice recently discovered that Lucy's urine contains HCG, also known as human chorionic gonadotropin. Beatrice, do you have anything else to add?
Yes, a pregnancy test relies on HCG to determine whether or not the person is pregnant. Let's take a closer look. Let's take a look inside the pregnancy test. The HCG lands on the strip and reacts with an antibody and an indicator molecule. The antibody will then bind to HCG. If HCG is not present, the pregnancy test will not give a positive test result. The usual indicator present in the pregnancy test is a pigment molecule. HCG is always present in a woman's body, but only present in high levels in a pregnant woman. The pregnancy test will only react if HCG is in high levels.
HCG is a hormone secreted by the developing placenta after fertilization. An enzyme-linked immunosorbent assay was developed to detect low levels of HCG in urine. Pregnancy tests use a method involving 3 different antibody preparations. The reaction zone contains soluble monoclonal anti-HCG antibody enzyme conjugates. The test zone contains immobilized polyclonal anti-HCG antibodies and a dye substrate. The control zone contains immobilized goat anti-mouse antibodies and a dye substrate. For a negative test demonstration, the test strip is dipped in a urine sample containing no HCG hormone. The sample is drawn by capillary action up the test strip to the reaction zone containing HCG antibody enzyme conjugates. The soluble anti-HCG antibody enzyme conjugates are dissolved and carried along in the capillary flow. The antibody enzyme conjugates arrive at the test zone. Lacking bound HCG, they flow past the immobilized polyclonal HCG antibodies and the dye substrate. In the control zone, the monoclonal mouse conjugates bind to the immobilized goat anti-mouse antibodies. The variable region of the anti-mouse antibody binds to a constant region on the antibody enzyme conjugate. The enzyme is then able to activate the dye substrate. The pregnancy test results. It has detected that no HCG is there. For a positive test demonstration, the test strip is dipped in a urine sample containing HCG hormone. The HCG is drawn by capillary action up the test strip to the reaction zone, where it binds with anti-HCG antibody enzyme conjugates. The HCG-bound antibody enzyme conjugates are dissolved and carried along in the capillary flow. The HCG-bound antibody enzyme conjugates arrive at the test zone. Other epitopes on the HCG molecule bind to the immobilized polyclonal HCG antibodies. In the control zone, the unbound monoclonal mouse conjugates bind to the immobilized goat anti-mouse antibodies. The fixed enzymes are now able to activate the dye substrate in both the test and control zones. Pregnancy test results have detected that the test activity is confirmed.
One of the many pregnancy tests available in public drugstores, and I will now demonstrate how to use one. First, I will start off by picking up some of my patient's urine sample with this pipette included in the kit. Then I'll drop 4 drops into the hole used to pick up the urine. And now we must wait 3 minutes to see the results. The results are in, and the 2 lines indicate that our patient is pregnant.
Congrats!
Back. So now that you guys have seen Lucy Know and that we've explained the chemistry behind how a pregnancy test works, we have brought onto stage the one and only
Lucy Know. Hello, Lucy. How are you today?
Hi, I'm good. How are you?
I'm good. Thank you.
So we just wanted to ask you a few questions of how the pregnancy test helped you and in what way it has benefited you.
Well, before I found out I was pregnant, I had this constant routine in life where I just partied or did drugs, and without finding out that I was pregnant, I probably would have caused harm to my unborn baby. So the pregnancy test helped determine that I was pregnant, obviously, and that stopped me from that horrible way of life. And as for society, I mean, if you're in my situation, I think you would understand that if you don't know you're pregnant and you do things like that, it'll cause harm to the baby, it'll cause harm to yourself, it's just, pregnancy tests help you stay safe. So, yeah.
It has also helped society because it has created jobs for people who create these pregnancy tests.
Yeah, and like the corporations that make the pregnancy tests make a lot of money, which ultimately increases the economy and makes it better. Okay, well, see you next time on 16 and Testing. Next week, we will be looking at this young girl named Sarah Ibrahim, so don't miss out. Bye!